Old woman is hospitalized due to a femoral neck uh, fracture that has occurred when she slipped while stepping out of the bathtub. Okay, so we have got a femoral neck fracture. The patient was diagnosed with a prolactinoma 3 years ago during evolution of amenorrhea, but she refused medical or surgical treatment. The tumor is being monitored closely and has not increased in size or caused any visual symptoms. So she had got prolactinoma, which is 3 years ago. The patient has no other medical problems, takes no medication, and does not use tobacco, alcohol, or illicit drugs. 3 healthy children, underlying mechanism. Okay, the question arises, the underlying mechanism for this patient's susceptibility to fracture is most likely to which of the additional manifestation. Okay, so you see, like, she had got prolactinoma and femoral neck fracture. So somehow this prolactinoma is influencing this femoral neck fracture. Okay, so let's see why. So I guess the answer should be vaginal dryness. Okay, so we are talking about, okay, so sorry, the underlying mechanism for susceptible to fracture most likely to cause which of the following additional. Okay, so in this question they have just wanted to know that another complication of prolactinoma. Okay, so that's it. These things does not happen in case of prolactinoma. Vaginal dryness happens. This is another complication for prolactinoma. So that's what we are going to see right now. The hyperprolactinemia. Okay, so prolactinoma mass. So hyperprolactinemia, like premenopausal woman, like in case of premenopausal women, we are going to say galactorrhea, then estrogen deficiency, like that's as a result of estrogen deficiency we are going to say oligoamenorrhea, like decreased bone density, or vaginal atrophy. Yeah, that's what I was looking for, because when the estrogen is decreased, the bone density is also decreased, so as a result the bone is susceptible to fractures. So in case of male, okay, in case of male, the infertility, decreased libido, impotence, because in prolactinoma the GnRH is going to get decreased. So that's why the same goes for the children or adolescents, that they are going to have delayed puberty or growth impairment, because GnRH and also growth hormone that is released from pituitary gland, because we know okay, that goes for physiology. If the prolactin is going to get increased, that's going to have negative feedback, so the other GnRH is going to get decreased. So mass effect symptoms like headache, visual field defects, and suppression of other pituitary hormones. That's what I was talking about. Suppression of other pituitary hormones. Okay, so that's why GnRH is going to get decreased, and also growth hormone is also, like here, growth impairment, because the growth hormone is also decreased. So let's see the explanation. The prolactinomas are the most common pituitary tumors. High levels of circulating prolactins, a hormone involved in milk production, result in galactorrhea. Okay, so prolactin helps in milk production, right? So that's why I'm going to say galactorrhea, non-lactational milk production. Okay, so this non-lactational, because that's not related to any pregnancy, that's just happening because I've got a problem. And infertility in premenopausal women. Excess prolactin suppresses GnRH secretion from the hypothalamus and leads to reduced secretion of LH. Okay, so the LS is reduced, FSH is reduced. So that's why I'm going to say hypogonadism in case of male, female, and children, adolescents. I have already shown them. Also, there's an ovulation, amenorrhea. The resultant estrogen deficiency can manifest vasomotor symptoms, like the patient is also going to see hot flashes, vaginal dryness, right, and atrophy and dyspareunia. So because estrogen maintains bone mass in premenopausal women, prolonged estrogen deficiency can lead to osteoporosis. Okay, that's why she has got bone fracture. So it's a fragility fractures, right? And men with prolactinomas may develop symptoms with hypogonadism. So in short, I'm going to just mark all the symptoms with orange color. Okay, so here also like hypogonadism and infertility decreased libido can be shown in case of men, and also galactouria is not so is also rare in both men, and postmenopausal women as milk production recurs. Okay, so all the things are all same, just we're going to talk about massive weak symptoms because headache, visual effect defects are can be seen because we know that the tumor is in the pituitary gland. So as the pituitary gland is increasing in size, we are going to have headaches because that's in the head. And also visual field defects because that's going to have an effect of the optic pathway. I mean the surrounding structures, right? The compression of the surrounding structures is happening, the eye, right? That's why visual field defects is going to be shown. So in short, educational objectives. So in patients with prolactinoma, there will be have circulating prolactin suppresses GnRH, hypothalamus, LH, subsequent hypogonadism in anovulation, amenorrhea. That's all the same things. So that's it. Fragility factors lead to vaginal dryness and atrophy. Thank you.